Good afternoon. In this next lecture, I'd like to talk to you about a very important topic, and that's the use of MR imaging to evaluate prostate cancer. Now, we certainly know in this lecture we'll describe prostate anatomy, prostate cancer, including a discussion of the Gleason score, prostate MRI, PIRADS, and then we're going to use these techniques to look at pre-surgical staging, radiation therapy and planning, monitoring response to therapy, and detecting tumor recurrence. And we certainly all know where the prostate gland sits, just beneath the neck of the bladder. The zonal anatomy is something we should also review. We know that the peripheral zone accounts for about 80% of prostate cancers in terms of their location. The central zone surrounds the ejaculatory duct, and the transitional zone surrounds the urethra, and that's the site of BPH, or benign prostatic hypertrophy. One of the beauties of MRI is that we can see the prostate zonal anatomy so exquisitely, particularly on our two T2-weighted images, where we have the high signal intensity smile here of the peripheral zone and the more central transitional zone. We can see the same zonal anatomy in the T2-weighted images. Prostate cancer occurs, of course, when prostate cells grow out of control, and there are often no early signs of prostate cancer or symptoms. Some men can have urinary symptoms or discomfort, but that actually is fairly uncommon. Some basic facts about prostate cancer we should review. It is the most common non-skin malignancy in men. It is responsible for more cancer deaths than any other cancer except for lung cancer. And there's microscopic evidence of prostate cancer at autopsy in many, if not most, men. The American Cancer Society predicts that this year there will be over 248,000 new cases of prostate cancer diagnosed. 1 in 9 men will be diagnosed with prostate cancer during his lifetime, but fortunately, this is the important point, only 1 man in 41 will die, which means that MRI can have a very, very important role in terms of diagnosing and treating these patients. There are currently over 3.1 million men in the United States who are indeed survivors of prostate cancer. Now we should think about the staging. Stage 1 is basically incidental prostate cancer. It may be found during surgery for BPH. It's not palpable, and you're not going to see it on imaging. Stage 2 prostate cancer are those tumors which are confined to the gland. They have not spread outside of the prostate. Whereas stage 3 cancer has spread beyond the outer layer of the prostate into adjacent tissues. And stage 4 cancers are those which have spread to lymph nodes or other parts of the body, such as the bladder, rectum, bones, liver, or lungs. The PSA is an important value for us to measure. Normal range is anywhere from 0 to 3.9 nanograms per ml. It stands for prostate-specific antigen. And it's a test, of course, which levels the PSA and measures the PSA in the blood. PSA is a substance made by the prostate gland that may be found in an increased amount in the blood if in prostate cancer. However, it's important to know that it's not a specific finding of prostate cancer. In findings, we also know that you can see elevated PSAs in infection or inflammation of the prostate gland or simply in BP.